Hello and welcome everybody to EV Revolution. I am your content creator, Dr. B. Welcome back. It is Friday, February 20th. Whoo! It's a big day in South Korea, that is for sure. Daegu specifically, and that is what we're going to talk about. I'm not going to touch too much on education today, but rather the coronavirus. That is the thing that everybody's talking about, and that's what I want to touch on today. So, here we go. This is a video as a huge shout out to the medical staff, the doctors, the nurses, the hospital administrative staff who are working tirelessly and around the clock to keep us safe from the current explosion of coronavirus or Corona-19 that is affecting many parts of the world and now has really come home to South Korea and Daegu specifically, where I live, in a really big way. So, as being on the front line, doctors and nurses, as a foreigner, on behalf of the foreigners here in Daegu, I want to thank you so much for your hard effort. This is a difficult time for you. I know there's a lot of stress, or I can imagine there would be a lot of stress with what's going on, and certainly I want to give you the highest thanks that I can in order to just tell you how grateful I am for me, on behalf of me and my family and the other foreigners in the community, for what you're doing. There are nurses in other parts of the country that have fallen victim to coronavirus. There's 5 in Chengdu specifically that I will mention later, or at least I did right now. So we know that the doctors and nurses on the front lines of this virus are not out of protection, even though they're using as much viral barrier as possible. It's still getting through. So take care of yourselves. You know, get good sleep. Make sure you're eating food, doctors and nurses. Take care of yourself first and foremost, because if we don't have you, that first line of defense, it's going to make fighting the virus a lot harder. Some news that has come out that I don't think is going to change too much. Daegu has been classified as a special care zone by the federal government or by the national government in Seoul. And this is going to help Daegu, the political apparatus, the medical apparatus, to, I believe, have more money coming into the city and will focus primarily on containment of the issue. So hopefully it won't spread outside a whole lot. Right now, at the time of recording, there are 156 total cases within the country, 52 new cases, and 41 of those are right here in Daegu over the last 48 to 72 hours. 39 of those cases have been specifically linked to Shincheonji Church. I'm not going to get into what that is or isn't. I'm just going to stay away from that. There are 16 active cases in Chengdu at the time of recording. Again, these numbers are bound to change. And this is where the 5 nurses come in. Those 5 nurses, or 5 nurses in Chengdu, have caught the virus as well. Again, these are frontline workers helping people, helping people in the hospitals, taking care of other people, and putting themselves at risk. So again, please do take care of yourselves. We need you. People need you. There are approximately 15,000 people screened around South Korea already, and I'm sure that number is going to rise. Some interesting things, however, about viruses and corona specifically that I thought were interested. I thought I would make a point of these as well. Business Insider had written that nearly 80% of symptoms that people get are either mild or asymptomatic. And asymptomatic basically means that there's no external or internal symptoms that the person feels, even if they have the virus, which means that their body is strong enough and their immune system is strong enough to counteract that. So good for your bodies if you have that going on. However, that does mean that you can carry the virus even though you are not sick yourself. So there is care to be granted for sure. And again, not everybody is going to show symptoms, but they could carry the disease onto somebody else. And if that person has a weaker immune system, it might have a detrimental impact on them. Now, here's another interesting thing that I found out. This comes actually out of the World Health Organization, that mayors, and we had that scare here in Korea as well a few years back, 34.4% of mayors' diagnosis, people who were diagnosed with mayors, died because of the virus. A rather large percentage, actually. SARS, on the other hand, was 9.6%, so much lower. Corona, less than 2%, or around 2% of the people who have contracted the virus have passed away from it. So even though we are seeing an increase in numbers, specifically in Daegu, it bodes well that there's a less mortality rate because people are being more careful, and the virus is perhaps not as damaging as what we might think. I'm not saying it's not an issue and that we shouldn't be concerned, but there are some pretty interesting statistics. Again, this is all at the time of filming on February 20th, 2020. Who knows what that could be in a month from now? We just don't know. But it's an interesting statistic to keep in our minds anyway. How can we deal with it? Well, certainly regular washing. There's the emergency beep that's going off on my phone right now. Regular washing of hands with warm or hot soapy water, key to the reduction of viruses, primarily from hand to mouth and on surface contacts, etc. So keep your hands clean. Really good idea to do that. We should be doing that anyway, but specifically at this time, of course, that is a good idea. The other thing that is mentioned is covering our mouth and our nose when coughing or sneezing. Certainly we can do this with our hand. However, that's going to put viruses and germs on our hands. We got to go wash them. We can just do this with our arm, at the joint part of our elbow there, inside, sneezing or coughing, and that way our hands remain bacteria or virus free. Keep those hands washed, though. Really good idea. What else? What else do you do? I mean, there's things that I do, of course, to help reduce the spread. What do you do? Put a comment down below. Are you in Daegu? Are you being affected by this at all? Talk to us. Let us know how you are dealing with it, your families, etc., etc. I'm going to link this to Facebook, so hopefully it will be picked up around the foreigner community here as well. Please add your shout-outs to the hospital and administrative staff, the political staff that is taking care and taking charge of this. We certainly do thank you. Maybe that's not being expressed. I haven't seen anything like that. Most of it is information for us. Craig White, if you're listening, shout out to you. You are doing an amazing job at getting those translations from Korean news services out onto the Facebook communities for what we're doing. So thank you so much for all of your efforts, and other Koreans who are posting into those English Facebook pages to keep the foreigner community up to date and aware. Thank you so much for all of that. And of course to the medical community who this is being shouted out to specifically for all of your hard work on the front lines of this virus. So you're doing a bang up job, guys. You really are. Keep up the great work and know that you are appreciated from everybody here in Daegu, South Korea. You have our thanks. Sign up to the channel if you haven't already. There will be new educational stuff dropping shortly. And from the foreign community to you, thank you very much. And remember, be the revolution. Peace.